Good afternoon. Welcome to today's episode of Oncology Data Advisor. Today's discussion is being held in honor of American Diabetes Month this November, and I'm joined today by one of our editorial board members, Dr. Joe Kalis, who's coming on to discuss the topic a little bit more with us. Dr. Kalis, thanks so much for coming on today.
Yeah, here. Always a pleasure. Thanks for allowing me to be here. I know diabetes is a topic near and dear to my heart because I've been a type 1 diabetic for I think 27 and a half years now. I had to think of the diaversary as the term I've come across of like when diagnosis happened.
Yes, absolutely. Would you like to tell us a little bit about, first of all, your experience with diabetes, and then some considerations for diabetes awareness in general?
Certainly, certainly. So I think for my own personal experience, was diagnosed back at the tender age of 10 on the way to a summer camp that ultimately didn't end up happening that year because of the unexpected diagnosis. But it's been quite an interesting journey for me, both as a patient and then now working in healthcare, having progressed from needing to do daily or multiple insulin injections each day to now some of the technology that's available with continuous glucose monitors and insulin pumps and algorithms that handle a lot of that background management. But I think an important thing to keep in mind is, everything I just mentioned with insulin and injections and pumps and so forth, a lot of that pertains to just type 1 diabetes. So that's what I've personally got. It's where the body's immune system attacks those insulin producing cells in the pancreas. But I think for diabetes awareness and in general terms, we also need to consider the impact of type 2 diabetes, which is a bit more common, at least in the United States and across the world, where the development of insulin resistance has become the issue. So not so much, say my case, where there is no insulin anymore that my body's producing, I have to use a supplement for that. But type 2 diabetes, it's where the patient's body is producing insulin, but it's not working as well. Their system and insulin receptors just aren't responding as well. In those cases, things like diet and exercise are going to be cornerstones of management of the diabetes. But we've also got a variety of oral medications and then even injectables now, things in that GLP-1 class like Ozempic and Mounjaro and others. So we've really seen a big growth, almost an explosion in terms of not only the number of cases of diabetes across the US, but also some of the options and strategies we've got to manage it.
Absolutely. Thank you for the overview. Since a lot of our target audience for these interviews is oncologists or other clinicians who see people with cancer, are there any considerations for people with diabetes who also have cancer? Anything to keep in mind there?
Absolutely. The first thing that comes to mind for me, practicing in pharmacy as I do, is that we use a fair bit of steroids, often for nausea prevention with many chemotherapy regimens, but also for management of immunotherapy-related side effects, or even symptom management of different pain aspects, maintaining appetite, etc. And we do know that steroids are going to be one of the classes of medicines that can really increase a patient's blood sugars quite dramatically. And we could have a patient, either type 1 or type 2 diabetic, get, say, 10 milligrams of dexamethasone IV as part of their anti-nausea regimen, and then experience blood glucose levels in the 300s or 400s for a day or two or even 3 days after. So one of the counseling points that I'll review with patients who are diabetic and also undergoing cancer treatment is that we often might need to collaborate with their endocrinologist or their primary care physician on some maybe tighter management strategies for the diabetes around those days of treatment, especially when steroids are involved.
Definitely. Are there any nutritional considerations specifically for patients who have cancer and diabetes that might help or hinder their treatment?
Definitely. I think my first line option there would be to have those patients, say, consult with a nutritionist or someone who's got that official background and training. But general concepts that I'll provide to patients, it applies both to those with diabetes and those without. But I try to recommend to folks to maintain more of just a healthy overall diet. I think of all things in moderation. Carbohydrates and sugars can certainly increase blood sugar levels. So if we're able to maintain moderation on those while adding in fruits and vegetables for healthy fiber, and then often as well, increasing protein intake can be helpful in cases of diabetes. as well as with maintaining general muscle mass and function in patients with cancer.
Great to know. Speaking of nutritionists, kind of brings into question like the multidisciplinary approach to diabetes management. Are there any specific specialties that patients with diabetes see, or any multidisciplinary considerations in mind there?
Yeah, of course. I mentioned different types of physicians a moment ago that we'd collaborate with. So, depending on a patient's situation, the complexity of their diabetes case, they may be working with an endocrinologist, so someone specializing in diabetes or other endocrine disorders, or they may be able to be managed through their general primary care physician. So then we've potentially got one or even two other specialty physicians that us in the oncology clinic would be collaborating with. But you bring up a great point with dietary and nutritional needs. Many patients with diabetes and also many patients with cancer are also working with specialists in that area of nutrition, really trying to optimize as many aspects of their care as we can, trying to keep that holistic approach of like cancer is an aspect of that, but we also need to keep in mind managing the other conditions that they've got. And that team approach with the interdisciplinary management, I really find to be a critical component.
Great to know. Along those lines, any other advice or suggestions that you would have for clinicians in honor of Diabetes Awareness Month?
Yeah, certainly. I'd say to keep an open mind because we've got many patients now who can either be considered pre-diabetic or have ongoing type 2 diabetes and management. But as well as that, we've also got patients where we've seen some rare cases where immunotherapy has been linked to directly causing autoimmune conditions like type 1 diabetes. So I would say for other clinicians out there, keep that open mind. The diabetes that a patient may have could be due to a variety of different factors and could be requiring a variety of different medications for the best management. And it's often possible to integrate all of that quite well, whether it's through looking for drug interactions like a pharmacist, as myself, might be doing, optimizing somebody's nausea medication by maybe tweaking those doses of steroids so that we're getting good nausea control while also not causing consistent hyperglycemia for a patient over several days. But that's where I find that interdisciplinary collaboration to really be key. Because I think with the cases and level of diabetes awareness in the country, it's certainly better than it was 27 years ago when I was diagnosed. But I think there's always still going to be work to be done in order to fine tune that and make sure that folks who are directly caring for patients always keep these different considerations in mind.
Absolutely. So as we wrap up, any parting messages you'd like to share either for healthcare professionals or for patients in honor of diabetes awareness?
Yeah, for both healthcare professionals and patients, I would encourage them to keep in mind that it's a journey. It's something that I personally have found helpful to take day by day. Is with diabetes being the condition that is, even if you're doing everything right, sometimes the body just doesn't cooperate. And it's important to give ourselves that grace to say, okay, maybe today wasn't my day, but tomorrow's a fresh day. I'm going to start and continue doing the best that I can.
Awesome. It's a great note to wrap up on. So thank you so much for coming on today to share all these messages with us.
Yeah, of course. Always a pleasure.